Okay, so I'm going to talk to you about radiation safety. So monitoring devices are used by veterinarian clinics to help track and evaluate ALARA procedures and to help ensure that individuals are not being overexposed to radiation. So ALARA stands for as low as reasonably achievable. Radiation exposure is tracked through dosimetry badges, and the company will keep a record of the results of each individual. So the maximum permissible dose is the maximum dose of radiation a person is allowed to receive over a certain amount of time. So the maximum permissible dose is 5,000 milligram per year or 5 rem per year. Technicians should try to keep radiation exposure as low as possible by carefully following radiation safety practices. The use of lead shielding is mandatory while taking radiographs. Lead gowns, gloves, thyroid collars, and goggles are the most commonly available and should be used each time you are in the x-ray room taking x-rays. Being exposed to radiation, you should always be wearing it. This equipment is not designed to block primary radiation. It only protects you from scatter radiation. Other types of shielding besides PPE that can be useful include portable leaded glass screens, which you can stand behind during an x-ray exposure, or having a radiology suite be built with lead-lined walls, which is what we have here at our hospital. So when taking a craniocaudal radius ulna x-ray, for positioning, the patient should be in ventral recumbency. For the measurement should be mid-shaft of the radius and ulna centering. And for the collimation, you want it to be proximal to the elbow and distal to the carpus. And for the centering, it should be mid-shaft of the radius and ulna. When taking a ventral dorsal thoracic x-ray, for the centering, you want it to be on midline at the level of the caudal border of the scapulae. And for the collimation, the cranial border should be the thoracic inlet, the caudal border should be the first lumbar vertebrae, the lateral border should be the body wall, and when positioning them in the V-trough, it should be the V-trough should be entirely within the collimated border. And for the measurement, we should measure at the highest area, usually at the last rib. When taking a ventral dorsal pelvic x-ray, a VD pelvis, the centering should be midline at the level of the ischial tuberosities. And for the collimation, the cranial border, we should be cranial to the crest of the ilium. The caudal, we should be distal to the patellas. And for lateral to the gradal tronchlors. And for the measurement, we should measure at the thickest part of the pelvis. Okay, so today I'm going to show you how to do a radius ulna x-ray on this cat, Abby. So what we're going to do first is come to our PAC system and select it. So we're going to do her front right arm because she does have a catheter in her left arm. And we're going to do the radius ulna right DP. And we're going to hit done. She's less than 20 pounds. So the settings for the KVP is going to be 66. The MAS is going to be 3.2. We can also reference our technique chart here. Less than 20 pounds, KVP is 66. The MAS is 3.2. So I'm going to go set that on our machine. And 3.2. And then when doing the collimation, you want to make sure that the centering is mid-shaft for the radius ulna, and that it is distal to the elbow and proximal to the carpus. And then I have my right lead marker here, and I have my lead gloves. So I'm going to put those on in position. No, Abby, just relax. Just going to get her in position. I'm going to line her up. You want to make sure that her elbow's in, but that her head is not in the shot. So once we have that, I'm gonna put my glove on and we're gonna shoot the x-ray. No, it's fine. Okay, so now that we have our shot, we have our marker in, just going to crop it. You're gonna rotate it. Okay, and then that is how you would take a cranial caudal radius ulna x-ray.